Welcome to NSB 104, 2021, Leading and Learning Assessment Task 2 by Workshop Group Number 1. Learning outcomes for today will be focused on defining patient-centered practice, identifying key contributors, describing the prerequisite professionally competent, and the ANSAT domain maintains capability for practice, how they're connected, what strategy is used to assess the prerequisite, and how this can assist the nursing student. The Australian College of Nursing believes that the principle of person-centered care is central tenet underpinning the delivery of nursing care and healthcare generally. Person-centered care means treating each person as an individual, protecting a person's dignity, respecting a person's rights and preferences, developing a therapeutic relationship between the care provider and care recipient, which is built on mutual trust and understanding. The group's definition, however, would relate to the pictures above. In previous eras of healthcare, the doctor would enter the room, sit down, tell you what was going to happen, and that's that. Whereas modern day healthcare and person-centered, there would be a multidisciplinary approach from the service point of view, and then the involvement of the patient, their support, be it social, familial, or even personal preference. The result in providing care is both holistic and supportive towards the patient whilst achieving the key responsibilities of ensuring health promotion. The contributors in person-centered care are identified as the healthcare provider and the patient. This is achieved through utilizing the four modes of being. Being in relation, showing how the interpersonal relationships can have a therapeutic effect. Being in a social world, how the patient interacts and lives their life, how they got to where they are, and who they have around them. Being in place, this focuses on the physical space of where the treatment is best performed. Theatre for surgery, social work could be done in the home space or palliative care, where is it more appropriate for the patient to reside in their time. Being with self, the fundamental human need of being recognized as a person and not as a diagnosis or a set of symptoms. This encourages to allow the patient to become on equal playing field with the team, and whilst taking into account their wants and needs, also appreciating the experience of the treating team so that the desired outcome can always be achieved. So what is professional competence? Professional competence can be defined as a combination of knowledge, experience, values, and reflection in order to provide effective care options and overall holistic care. Professional competency is a fundamental element of the nursing profession, as it is the ability to base clinical judgment on prior experience, knowledge, and reasoning. It influences the thinking and decisions behind the clinical skills and interventions, having the capability of improving the quality of outcomes of the patient care. Maintains the capability for practice. The Australian Nursing Standards Assessment Tool, or ANSAT, is an evaluation approach which is used by facilitators when observing nursing students on clinical placement. Through implementing the ANSAT tool, it allows for the facilitator to give constructive feedback and break down the student's strengths and weaknesses into clearly defined categories. This assists the student to better understand expectations and allows for improvement in specific areas of practice. The third domain focuses on maintaining a capability for practice and focuses on 5 key areas, which include being dedicated to a continual education for not only themselves but to others, being able to engage in feedback and reflection in order to facilitate ongoing professional education, the ability to educate others and allow for informed healthcare decisions and autonomy, acknowledging when personal practice or that of others is below practice standard and working towards improvement, as well as showing accountability for one's own decisions and actions. The prerequisites that correlate within the number 3 domain of the ANSAT tool all relate back to person-centered practice. Each point has the basic strategy of feedback for the student to rely on. For example, the first point focuses on wanting commitment to lifelong learning of self and others. This is expected that as nurses, we reflect and use our colleagues as support systems. By using personal experiences, we can work with the patient and their family to provide a strategy of care tailored to them. To completely follow the third domain, nurses must understand that without each point being completed, the process of person-centered care will not be successful. The second and third domain include reflecting on practice, responding to feedback, and demonstrating the skills to assist the patient in decision-making. These two domains are linked by the student's ability to use personal experiences, their knowledge and information given by patient's health to assist in delivering patient-centered care. By recognizing that feedback is needed in all aspects of professionality, developing interpersonal skills in communication will improve patient-centered care. This is needed when leadership is founded in the workplace and within a patient care team. As a student nurse, being able to take responsibility, recognize mistakes, demonstrate accountability, and reflect will all improve the patient-centered care. These prerequisites will all lead to a more thorough and safer patient-centered practice. The patient will also feel validated and encouraged to communicate their needs. Feedback is the act of receiving information regarding your patient's performance, behaviors, and actions, language, communication, professionalism, and knowledge and understanding. Professional competence can be built through basic clinical skills and consists of the use of communication, knowledge, clinical reasoning, values, and reflection in daily practice. Feedback is linked to professional competence as nursing students are receiving feedback to better their skills and knowledge, allowing them to be confident, professionally competent within their performance. Feedback has the potential to contribute to a student's self-awareness and their ability to self-assess their level of competence. This will assist nurses to figure out any impairments and obtain further education by the multidisciplinary team to become professionally competent. Feedback is essential for nurses as they are obligated to further educate themselves and participate in professional organization to ensure they are professionally competent and patients are receiving the best care possible. Feedback, the student's silver bullet on maintaining professionalism. Giving and receiving feedback well is an important strategy for achieving professional competence. The ACT model is a great guideline for students to apply when they are presented with feedback. A. Accept and listen to the feedback. C. Clarify, ask questions. T. Thank the person for their help. It is also important to develop a growth mindset in opposition of a fixed mindset. This mindset cultivation will enable the mind to think of receiving feedback as learning and growth opportunity and can be used throughout the duration of placement of one's career. Feedback improves performance, confidence, and trust within the workplace. The improvement of these factors help to achieve patient-centered outcomes. The patients and other team members can be involved in giving, receiving feedback, which will help deliver patient-centered outcomes and encourage the involvement in the care. A collaboration, trusting and confident team will provide the good care experience and feeling of well-being for the patient. The patients will sense they are in a safe environment in an existence of healthful culture, full of confident and collaborative individuals working as a team to achieve a common goal. The benefits of using feedback as listed above has a flow-on positive effect for everybody involved and allows everyone, including the student, to deliver best practice through person-centered care and ensuring person-centered outcomes are achieved. In conclusion, we have defined patient-centered practice. We've been able to identify key contributors in person-centered practice, describe the prerequisite, being professionally competent, and the ANSAT domain maintains capability for practice. We've learned how these are connected. We've seen what strategy is used to assess these prerequisites, being feedback. And we've been able to identify how this can assist the nursing student in maintaining their professional competence and providing the best patient-centered practice they can. Thank you for attending today. Please feel free to pause the video now and have a look at our references and follow up with your own information if needed.